Throughout this session, I'll be thinking of everyone I've met over the last few months, and I'll be focusing on what matters to them and to all Saskatchewan families today. Because politics should never just be about the province doing well, but it should be about people doing well. Sylvia Phillips has advanced dementia, and she's been in Saskatoon hospitals for the last 2 months as she's waited for a care home placement. Sylvia's son Leon says the family has, quote, been going through hell these past 2 months, end quote. They maxed out their vacation days to be with her, but when they had to go back to work, Mr. Speaker, they felt they had no option but to pay for private care providers to go into the hospital at a cost of about $1,000 per week to simply help with their mother's basics. My question, Mr. Speaker, for the Premier, how can he explain why families are being forced to pay for private care providers to go into hospitals to help with their loved ones?
The reason that seniors are occupying beds in hospitals is because there is nowhere else for them to go. The minister has admitted that this government has hardly added any new long-term care beds, despite having 6 years and record revenues with which to do so. No wonder Barbara Blythe, the senior from La Ronge, who is pushing for a much-needed seniors care facility, said recently, quote, "To stand up in the legislature and say, oh, we've been aware of the problem for some time. My question then is, then why the hell haven't you done something about it?" End quote.
And here are some quotes from the Resident Family Council minutes from their September meeting. It was total chaos. There was no assistance in the main floor dining area, and call bells were ringing constantly on the units. Care being provided is both shocking and horrible. To the Premier, when he hears words like chaos, like shocking, like horrible, does he realize how far away we really are from having personalized care and the dignity and the respect that Saskatchewan seniors deserve?
Speaker, it's clear that seniors' care in this province is getting worse under this government. Instead of improving minimum care standards, which it should have done, it simply did away with those minimum care standards. Instead of ensuring appropriate staffing levels, it simply lowered the expectations for the quality of care that seniors should receive.
73% of teachers vote no on the tentative agreement. That's a strong indictment of this government's approach to the education sector.
The problem here is that government's entirely out of touch with the reality in today's classrooms, yet it's taken a government knows best approach and rammed through with its own agenda. We hear that same sort of nonsense in the response from the minister, where he knows he's stuck teachers with bigger class size and cut supports, yet tries to tell them that somehow everything's fine.
Has he heard enough about the negative effects of overcrowding yet, or is he still just ready for more strange excuses about why he won't implement a cap on classroom sizes?
When the economy is doing well, why are there fewer EAs in so many schools, and why are teachers left alone to deal with under-equipped and overcrowded classrooms? We know, Mr. Speaker, that the underfunding of First Nations education on reserve is a huge concern for our province, where on-reserve students receive half to two-thirds of the amount of funding that students off reserve in the provincial schools would be receiving.
A matter of basic fairness and common sense, Mr. Speaker, that Sacred Heart Community School should have a gym just like any other school.
Ministre, quand est-ce que ce gouvernement va soutenir adéquatement l'éducation francophone en Saskatchewan? When will this government adequately support francophone education in Saskatchewan?
P3 school schemes, we've shared real and wide-ranging concerns from school board members, community groups, auditors, the Tax Federation, the construction industry, parents and teachers. Those concerns have been arrogantly brushed off by that government. Now all the opposition parties in Alberta, the Wild Rose, the Liberals, the NDP, have come together to fight against that government's P3 school scheme. This week, the leader of the official opposition in Alberta, Danielle Smith, said, quote, "Taxpayers are going to end up paying much more for these projects because they are debt-financed by private companies," end quote. What's the minister's response to that? 3/4 of the schools' roofs will fail in the next 5 years. Currently, that government has no plan on this front.
What Regina residents, Mr. Speaker, and really people across the province cannot understand is how it is that an ER here in our capital city has to have its hours scaled back at a time when our province's economy is strong.
Instead of just being ready for excuses, when will this government be ready to address overcrowding in emergency rooms?
Mr. Speaker, we see that the Premier came ready for excuses today. My question to the Premier, if everything is as wonderful as the Premier just stated in that response, Mr. Speaker, why is it that the Regina-Capel Health Region will likely be scaling back hours for the ERs here in Regina? Why is that?
Hear, hear.
The Wolseley Hospital has been shut down for 5 months. The government claims it's temporary, but local residents no longer believe that. And it's not just Wolseley that is experiencing reduced healthcare services under this government. The emergency rooms in Big River, Central Butte, Coronach, Spiritwood and Waka are all still closed.
This is what Zambori says, quote, "The pressure is immense in Regina and Saskatoon. What nurses are telling us about the pressure is that they are very fearful for patient safety. They are very fearful that there is going to be a tragic event happening," end quote. So my question is for the Premier. Is he also very fearful for patient safety, or does he think that Saskatchewan's nurses are overreacting? Suzanne Stewart is clear that our healthcare system has been getting worse in recent years. Mr. Speaker, I'll take the word of an RN with 36 years of experience over the words of this government any day. In her last 2 times in the hospital as a patient, Suzanne says the hospital was, quote, "filthy dirty," end quote. And she doesn't blame the frontline staff. She says the staff are, quote, "stretched beyond their capacities due to cutbacks," end quote. Mr. Speaker, how does the Premier explain healthcare facilities that are described as filthy dirty? This government is not doing its part because people do not have access to the services that they expect, especially when the economy is doing well.
But how many more budgets do we need to wait for before this government will do something meaningful when it comes to mental health? Life-saving measures can be implemented now. They need to be implemented now.
In recent months, Mr. Speaker, we've heard of another tragic death of a foster child, the 5th child in care to die under suspicious or criminal circumstances in just the last several years. And just yesterday, the provincial auditor reported that the government is still not doing enough to protect vulnerable little ones.
We need to work together for all Saskatchewan people. Hear, hear. We cannot be using, and driving a wedge between residents of our province. It is wrong. It's a wrong message to send.
When we talk about smart growth, Mr. Speaker, we're talking to make sure that absolutely everyone in this province is engaged, Mr. Speaker, and that we don't go after working people in northern Saskatchewan, Mr. Speaker, that we work with them to own their own homes, give them the dignity of home ownership.
Mr. Speaker, only one province has a minimum wage that is lower than Saskatchewan's minimum wage.
Is this government forcing higher property taxes onto families and businesses by not upholding their end of the bargain on sharing of PST revenues?
Many farmers are upset with how this government is dealing with insurance claims for wet acres.
Statistics Canada tells us Saskatchewan students pay the 2nd highest level of tuition in the country.
This government recognized what PA residents and northern Saskatchewan residents know, that PA needs a second bridge now.
Rather than allowing the Crown to invest in the grid to make it more reliable, renewable and affordable, the government forced SaskPower to jack up rates to cover their own financial mismanagement.
In fact, according to a recent Environment Canada report, this government isn't even on track to meet its scaled-back emissions targets. We're now on track to be 24% higher than the target. That's not a record to be proud of, Mr. Speaker. We saw cuts to environmental assessment, cuts to environmental protection, and we saw no reference, Mr. Speaker, no action on climate change programs. So we have a disconnect here between the sales job and what is the reality and the actual actions of this government.
The NDP have been clear that we want the provincial government to reduce its over-reliance on the one-time non-renewable resource revenues. And we also want the provincial government to establish a proper savings fund. That's just common sense. And that's exactly the kind of smart growth approach that we've been advocating.
Speaker, for the first time in our province's history, the provincial auditor refused to endorse this government's financial statements. The government claimed that there was a surplus of about $60 million at the end of last fiscal year. But the provincial auditor says that the truth is that this government ran a deficit of close to $600 million. So the first time ever in our province's history, the provincial auditor issued an adverse opinion and warned legislators and the public that, quote, much of the information included in the GRF 2013 financial statements is wrong. How can Saskatchewan people possibly trust a government whose financial statements are proven to be full of errors and not reliable?
I recognize the Premier.